Do you advise patients to avoid icing after treatment? What if it's hurting their recovery? Icing may seem like the go-to, but it could actually slow down the healing process. Curious about what's really best for recovery? Watch the full video to learn how heat could be the key.
Does diet play a part? Can you intermittent fast and help to improve your stem cell response? Different things like that can all play a part in things.
Do you tell your patient not to ice the treated site in order to not impair the recovery?
Initially, I tell them to heat. We're trying to increase blood flow into that area there, and ice can be a vasoconstrictor. It can decrease blood flow, but that's exactly what we're trying to create. So the first 48 hours, I say use heat, use Tylenol. I have them try to avoid the anti-inflammatories. That's a whole nother side topic on whether or not anti-inflammatories can affect the difference between the COX-2.
Don't forget, if you want more about the business of orthobiologics, I have a podcast, or you can go on my website, The Business of Orthobiologics, and tune in.
There's some studies that show that COX-2 do not impair the platelet aggregation, and then also all the other medications that you can potentially take, right? Should you be stopping statins beforehand, aspirin beforehand, making sure that you haven't had a corticosteroid injection 6 weeks prior. These are all little things that you can do to try to optimize, because there's some data that supports some of that. Does diet play a part? Can you intermittent fast and help to improve your stem cell response? Different things like that can all play a part in things. Stopping the smoking, which is also a vasoconstrictor. So these are all things that some of the data is out there that can support it, but do we have head-to-head studies? Very few to really support that though.
Yeah, absolutely. And so some of you are maybe thinking, wow, John just dropped a huge knowledge bomb on us. So now we're like super smart. We're ready to go. We're getting after that. Like, how do you go ahead and be successful? So what's the next step? Obviously, you need a system. You need to have knowledge. You need to attract the right patients, have that cash-based business. Don't miss out. Please subscribe to our newsletter now to stay ahead of the world of orthobiologics. You can find the link below.